Hey everyone, so today I want to talk about oral hygiene and just kind of teeth in general and some tips that we can use to keep our mouth looking great all of our lives. Recently just finished up my work in my mouth. I'm so happy. I kind of got the all clear from my dentist that as long as I just do routine cleanings, I should be fine for, the rest of my life, basically. Of course, unless there's like trauma or something, and we all know that I have this like huge phobia of losing teeth or whatever it is. I'm not sure where that came from or whatnot, but actually my dentist and I we're talking, and that is a real phobia actually, of losing your teeth or something like that. He was joking around and saying, if you did ever get a tooth knocked out, all you have to do is just pick it up, rinse it off, and shove it right back in. Some people feel that the amount of mercury that's contained in the metal fillings is enough to poison fish and things like that. There's other people that believe that the amount of mercury is so small that our bodies are able to process them out since they've been using them for over 150 years and there's no real side effects to say that they are horrible and they should not be used. So basically it was my own kind of wishes that I have them removed. For one, they're not very sightly. If you laugh really big, then you have like a bunch of kind of dark stuff in your mouth, and it's not very attractive. So my dentist, who I absolutely love, he's like the best dentist in the whole world, he has developed some techniques that are pretty unique. He studied, I think, overseas in Switzerland to learn some of the techniques that he uses. He always stresses this one point to me, that if you are going to have the metal fillings removed, make sure that your dentist uses something called a rubber dam. And that is like if you were to take just like a latex balloon and cut it in half and open it up and it was, a square patch. They use that and they punch holes in it. And it's kind of like orthodontics, if you remember how they use the ring to put around your back molar. They do that, and whatever tooth they're working on, they basically put this rubber dam around it, and it covers the rest of your mouth. So when they remove the metal fillings, you don't ingest any of that, because that would be really, really bad. So if you do have your metal fillings removed, make sure they use a rubber blanket, or a rubber dam is what it's called, so that you don't ingest any of the material once it is removed from your mouth. And also, the rubber dam helps to keep that area very dry, so that when they do the bonds of the white, it stays very dry, so they'll last a lot longer. And his technique is actually kind of unique because he puts the anatomy of the tooth back into your tooth. So some people that have white fillings, it might look like a piece of gum or something is stuck in their tooth, which isn't what you want at all. So for my tooth, he actually sculpted back the natural grooves that would obviously be there had I not had that procedure done. So when you look at my tooth, it just looks totally normal, but there's actually a filling there, so it's really cool. The other thing that we talked about was how important it is to floss every day. I know that's very, very tough, but it will help out in the long run tremendously for your gum health as well as just the overall health of your teeth and mouth. The number one culprit for cavities and just tooth decay in general is food. And the food gets into those grooves in the anatomy of the tooth that I was just talking about, and it works its way down, and bacteria grows, and that's how cavities start. And cavities form very slowly. They can take years before they reach the nerve of the tooth, which is when you'll actually start to feel pain from the cavity. So once it gets to that point, you definitely want to go in and have something done about it right away. You don't want to let tooth pain linger for too long, because that means that the nerve in the tooth is essentially dying. So the best thing you can do to avoid this is to visit the dentist at least twice a year for people that are, I would say, maybe 15 and over, at least once or twice a year, and they can check to see if you have any cavities that are forming or have any trouble going on. They can catch it early on, because if you go too long, then you'll need a root canal and you'll need a crown, and it's just not something that you want to go through. Brushing at least once a day and brushing at least twice a day. I try to brush after, if I eat something that I know gets stuck in my teeth, I will rinse or brush as much as I can. Some other things that we talked about that I found really interesting was that he said that some people don't even feel when they have an abscess in their tooth. So you might feel like intense pain for a short period of time, and you may take antibiotics and think that it goes away, but that abscess can actually work its way all the way down to your jawbone, and that's really, really bad. You do not want to ever let your tooth pain go that long, because you'll actually eventually get holes in your jawbone. And not only that, but if the bacteria reaches far enough into your bloodstream, it can actually cause strokes and heart problems. So your oral health is a lot more important than some people might realize. Some people might think it's just a cosmetic thing, but it can actually affect your heart and other parts of your body. So for my everyday routine, I typically brush with this. It's a powder toothpaste. I know that might sound really weird. I guess it's not a toothpaste, it's a tooth powder. But this is from a brand called EcoDent, and this is their Daily Care fluoride-free, low abrasion, original mint, naturally effervescent baking soda tooth powder for healthier looking gums and teeth. So this is what the bottle looks like. And I really love this tooth powder, because it looks just like what it says it is. It has the effervescent properties just like any other toothpaste would. And yeah, so that's what I use. It's fluoride free. You want to avoid fluoride. It will help to avoid cavities, but it's chemical, and it has been linked to various different problems like slow mental development and things like that. So it's usually present in a lot of municipal water treatment facilities, so you're probably getting fluoride from your tap water, so you definitely don't want to add it into your toothpaste or tooth powder. So I do that. I floss every day, or I try to every day, but sometimes I skip it. But I try to floss as much as possible, because the other thing about your teeth is your gums, and your gums are almost more important than your teeth, because once your gums start to have problems in terms of receding or things like that, there's really not too much that they can do for you. They can do gum grafts, but after a while they can only pull your gums up so far. So, once your gums start to go, it's really not a good thing. So gently brushing your gum line will help with the gum care. But the other thing is to get all of the plaque and tartar from between your teeth, because your gums don't like plaque and tartar, and so they try to move away from it, and that's what causes the gum recession. So that's my routine that I do every day. I don't usually use any kind of mouth rinses or washes. I do brush my tongue. That's also very important. You want to brush your tongue that's where a lot of the bacteria is hanging out, is on your tongue, which is the reason for bad breath, of course. And when you're brushing your teeth, you want to use a toothbrush that is marked extra soft. Even the soft ones are a bit too rough for your gums, and that can lead to gum recession as well. So look for extra soft when you're buying your next toothbrush. They're hard to find. I've only seen one company that makes extra soft that's actually like legitly soft. So you might have to search a little bit for that, but it's definitely worth it. To make sure your gums stay nice and healthy and everything. Aside from that, I just make sure that I don't eat sweets, of course. So that's a number one thing. Is sugar is really pretty detrimental to your teeth, especially candies that are very sticky, like taffies, Twizzlers, Starburst. Those kind of candies that when you eat, they get stuck in the grooves of your teeth. And as I mentioned before, that's where the bacteria hangs out, and then it slowly crawls and hangs out and deteriorates your teeth. But a yearly cleaning really is only about $100 depending on where you live. So don't let that stop you from getting your teeth cleaned if you don't have insurance. It's not like $2,000 to get your teeth cleaned generally. It's only about $100. Also, a lot of the things that insurance covers are kind of the basics of dental care. So they won't, basically the white fillings they see as a cosmetic procedure, so they won't cover those, I don't believe. I mean, you have to ask your dentist individually, but I don't believe that they cover those 100%, so you will have to come out of your own funds to do that, but it's definitely well worth it, or they may cover like a percentage or something like that. I'm not exactly sure. So the point of the story is, if you're a bit apprehensive about the dentist for whatever reason, don't put it off, because you're only hurting yourself and you're only making it worse for you later. Definitely make it a priority to take care of your teeth, because, like I said, it affects other part of your health that you maybe didn't realize, like your heart and things like that. So yeah, let's start off the new year planning to really take our oral health care very seriously. So thanks so much for watching, and I would love to hear what's going on with you guys and how your new year preparations are coming along. And I will talk to you guys again very soon. See you later. Bye.